Morning.
Morning.
Hiya. If you'd just like to introduce yourself to the students, let them know your role and tell them a bit about the company that you work for.
So my name's Robin Binks. I'm the Corporate Head of Nursing at Sherwood Forest Hospital's NHS Trust. So for many of you will know that this is your local hospital. It is a acute trust. When we use the term acute, that means acute medical versus community hospitals, which look after patients in the community, and mental health, which looks after people with mental health problems. So we look after people with acute medical problems. So whether that be respiratory, cardiac, had a stroke, so anything medical wise will come here through our front door.
Amazing. So with your role as a head nurse, what does that kind of entail?
So it's a very varied role. So within the organisation, so apologies to some of you if you already know this. So within a trust, you have the executive team. So we have a chief nurse, we have a deputy chief nurse, and then we have a group of heads of nursing. So the urgent emergency care division has a head of nursing. The medicine division has a head of nursing. Women's and children's has a head of nursing, but who's also a midwife as well. And then we have a head of nursing for our theatres and ITU area, and then we have somebody that oversees outpatients. So we are essentially as a head of nursing, I'm the most senior nurse over a group of areas, and then I report straight into a deputy chief nurse or the chief nurse. In my current role as a corporate head of nursing, I report straight into the chief nurse on the corporate portfolio. So my area of work is winter and currently the COVID pandemic. So I'll just talk a little bit about winter at the moment. So every year as part of the NHS, we devise a plan to get us through winter because we know people become more unwell during winter, particularly the elderly, people with respiratory problems, and that puts an enormous amount of pressure on our health system. So within Sherwood Forest Hospitals, each year we assign a head of nursing to oversee winter to ensure that patients receive safe, timely care to a high quality, to making sure that care isn't compromised and it's harm-free care. So when we talk about harm-free care, it means care that we haven't caused harm, so people receiving good quality care. And then the other part of my role is overseeing the COVID pandemic. So we all know what that is. And it's ruined most of our lives, and my social life hasn't been the same. So part of that aspect of my role is supporting the nursing part of the organisation in ensuring that we're delivering right timely care to our patients, but also ensuring that our staff are supported. So for many of you who are out and about, anxious about COVID, that applies to healthcare workers as well. So part of my role is ensuring that they're supported, that they've got the tools that they need to do the job, but also that at the difficult times that there's somebody there for them. I'm also responsible for the testing programme for our staff. So you will have noticed within the media recently that we are now starting staff testing.
Yes.
So part of my role is to implement that across the trust. So for 4,500 staff, implementing a programme so they can be tested every week, but also so they can get the results, but also there's somebody there to answer those questions. Because many of the questions are, what about my family at home? Or what about my partner? Or can my children still go to college? So it's about answering some of those. Just because we're healthcare workers doesn't mean we automatically know the answers. We have to go and ask them ourselves.
Okay, so do you still do kind of the practical side of nursing, or is it more management now that you do, essentially?
So the high predominantly aspect of my role is management, but when the hospital is, we call it full to capacity. So that's literally is when we have no more space, that I will, as you can see, have my uniform on all the time, and I will go and help where I can.
Okay.
So I'm not assigned to a ward to work on, because within my role, I oversee a series of areas, but I see it's part of an important role as a senior nurse, that when it is busy, that I still pop a uniform on and wear my uniform and go and help out. So I've worked in ED and help out in ED regularly to support the team and work alongside them. So if they're busy, so I'm with them when they're at their most busiest.
Okay, so at the moment, what does a typical day look like, or is there no typical day?
So it is all a bit variable at the moment because of the way the agenda's changing quite a lot with COVID, and we're preparing for winter. So a traditional day I can go through what yesterday was.
Yeah.
So the day would start at 7:30 with a safer staffing meeting. So myself and the other heads of nursing meet and talk about the staffing across the site for that day. So we ensure that we've got safe nursing numbers in each of our areas, and do we need to do anything to make an area have the right number of staff for that. Then moved into a bed meeting. So we look at the overall occupancy of the trust and look at what's happened overnight. So we doing it a bed meeting at 8 a.m, 11 a.m, 2 p.m, 5 p.m, and 8 p.m. So between the 8 p.m. and the 8 a.m, we look at what's happened across the site. Is there anything we need to do straight away? But also look at what capacity we've got to admit patients into. How is ED looking? And then we kind of make a plan for the day from there. I'll have to get the calendar up now to remind me what yesterday was, because it was it feels a long time ago. And then looked into, so as I've already mentioned, a part of my role is looking at implementation of COVID and staff screening program. So I did a meeting with colleagues from infection control, the labs, human resources, occupational health, and the staff swabbing team that we've put in place this week to make sure that our plan's in place, that we need to do anything, revisit some of the actions, and what do we need to do to go through the next phase.
Yeah.
So for that is now, for the last 2 weeks, we've been doing that half an hour every alternate day, because we need to work at pace, because as you guys out there in the community want those responses, us inside need to be able to provide them. So we need to work at pace to bring that together. Also, a big part of my role is doing coaching. So as a senior nurse, there are beneath me is a tier of matrons, ward leaders, or ward sisters or charge nurses, whatever you call them, deputy ward leaders, staff nurses, non-registered staff, so they can be clinical support workers, healthcare assistants, and domestics. So part of my role is to provide some coaching. So yesterday I spent an hour or so with somebody going for the first ward leader's position. So doing some time with her, looking at how to prepare a personal statement, how to prepare for an interview, and what to expect from the role. So as somebody who's previously done that, but also somebody who interviews regularly, it's given them my insight of what to expect. So from that, it kind of makes you always think around, actually, no matter how long you've been in a role and your level of experience, be that at interviewing or being the interviewer, we always need help.
Exactly.
So somebody who's been there before, or somebody who'll be reading your personal statement. So in the same way that when you were doing your GCSEs to your A levels to university, the bar goes a little bit higher. So it's getting somebody who is regularly doing that to help you with that preparation. So when you go in for that interview or you're doing that personal statement, that they can help you to pitch it right and what they're looking for specifically to extract it. But also as well, many times it is to alleviate some of the anxiety, because nobody likes being interviewed. So actually it's making them feel at ease when they're going into an interview, getting some help, getting some support from somebody who interviews quite a lot. And for myself, who's been interviewed quite a few times, that would just help that as well. So even at my level as a head of nursing, I have that myself. So I have somebody who's external to the organisation who, when I talk about organisation, I mean the hospital. I use somebody who works in another hospital to help me with that. So no matter how senior we become or how many times we've been to university, that actually we always need help when we need it.
Yeah, exactly. So just out of interest, how did you get to this point in your career? Take me back.
So I will admit, and people find it very strange, I never actually wanted to be a nurse.
Okay.
So at the age of 17, 18, I was given the choice by my mother, you either go to university or you get a job.
Okay.
It's one or the other. You're not sitting at home. So I thought, actually, what do I want to do? I didn't know what I wanted to do. And then my mother is now a retired nurse, and my sister's a mental health nurse. And my sister just said, actually, if you do nursing, you can go anywhere in the world. So, and even if you qualify as a nurse and you don't want to carry on, it actually opens so many doors for you, because as part of our training, you cover science, you cover working with people, you do research. So it opens many a door. So actually I thought, well, I'll give it a go. Part of me was, you both do it, so it can't be that hard.
Yeah.
So I kind of fell into it. So I'm originally from Liverpool. I applied to Nottingham University. I was quite fortunate. My sixth form tutor helped me with my personal statement, submitted for, as you do, through UCAS, and I got a invite to Nottingham University. So I was very lazy. I got an unconditional offer, so I didn't bother going to any other university interviews or do anything else. So I then started my training, and then obviously 3 years training to be a nurse. My career has all been in Nottingham, so I spent 13 years at Nottingham University Hospital. So I had a real interest in cancer nursing. So I spent 6 years working on the cancer wards at Nottingham City Hospital, and I did a specialist degree in adult cancers because it was a real area of interest for me. But at that stage, I was enjoying the leadership part of my role, so carried on pursuing that avenue, because for me at that stage, I realised that that's the bit I enjoy. I really enjoyed working with looking after patients, but actually it was the managing the lead and the developing the teams that actually I begin to really enjoy. So as a result of that, I then became a charge nurse on a urology ward in order to get that further leadership experience, and did that for about 2.5 years. And it was really interesting working with a different team, implementing some national initiatives. So Productive Ward was adopted from Toyota, and actually making a ward run more productively. And as a result of that, I ended up doing some work with NHS Improvement and looking at how you make wards more productive, and did a lot of work with visiting hospitals coming to the UK to look at how we did it. So people from New Zealand, people from Australia, and people from Europe coming to look at how we did that, and did a lot of talking around service improvement. We then started looking at enhanced recovery after surgery. So basically developing pathways for patients so they could go home sooner. So I started doing some work on that as well, and got a real interest for improvement, and did a presentation at the International ERAS conference on what difference does it make to a patient, because actually with what we implemented was the staff knew when somebody needed to go home. So just give them a list. If they tick all the list, then the patient can go home. You don't need to be by a consultant. So around that empowerment. So I got, and that for me was really liberating and really interesting. So I was quite fortunate then to be offered a matron's position. And I went back into oncology. So a real area of interest for me, that it was something that I wanted to carry on doing. So I went back into oncology as the matron and had a really good time. Was involved in the development of the teenage and young adult cancer unit in Nottingham, development of the chemotherapy services. And so it was great to go back and actually do more stuff. And for me, it kind of went, I actually really enjoy the pathway that I'm on. So there was still an opportunity to go back to the ward-based care or go into specialist nurse role. So within nursing, like I said, you can almost do anything. So you can either go through the leadership route, you can either go through the academic lecturing route and work in universities, or you can become a nurse specialist. And a nurse specialist is a specialist nurse. So it is a specialist in that area. So we have surgical ones, medical ones, cancer ones. So whatever your interest is, there will be a specialist nurse for that. And then you've also got staff who want to work on the wards. And actually that's great, because if we all want to do all of this, we've got nobody doing this. So for me, it's great. And it's quite refreshing when somebody says, actually, I'm really happy doing what I'm doing. And for me, it's okay. How do I keep you happy? So you carry on doing what you're doing. So it's enabling all of that to happen. And so I carried on within the matron's pathway. And because I enjoyed the leadership so much, I did a postgraduate certificate in leadership at the University of Nottingham and innovation practice. So that drew upon the improvement work that I'd done before. It also further brought together the leadership stuff that I'd done.
Yeah.
And then I moved into a deputy head of nursing, so for the surgical division. And for me, it was great because I then built on it again, went and got more experience. So I'd done surgery already, I'd done oncology. So for me, it gave me something different. So I did that for about a year. And whilst I was doing that, I realized actually, I'm enjoying what I'm doing, but I actually want to do some more academic work. So I dropped back down to a matron for a year and then completed my master's in health and social care. So it gave me that further rounded experience both clinical and academic and leadership to then apply for future jobs. I then went to work for NHS Improvement. So NHS Improvement is a bit of, in all honesty, it's a bit weird because it's kind of a bit of a mixture sort of role. So my job covered working from the Welsh border over to here in Sherwood. So you're working with mental health trusts, secure hospitals, so Rampton Hospital, community hospitals, orthopaedic hospitals, big university hospitals like Nottingham University Hospital, Derby. So it was really good to actually get out there and do stuff and actually support them with their improvement work and putting people in touch with stuff. So we're struggling with this. Do you know anybody? Okay, I don't know anybody, but I can put the feelers out for you. So you end up doing some work with them. And the bit why I say it's a bit weird, because also you look at the performance of the trust and you meet with the executive team. So as I said earlier, nursing reports into a chief nurse. There's also a chief executive, there's a medical director, and there's a chief operating officer. So in my role in NHS Improvement, I'd be meeting with them with their counterparts from NHS Improvement and looking at how the trust was performing. So actually we were helping them improve, but actually we were holding them to account on their performance and how they were functioning as a trust. So it was really interesting to actually look at it from both sides. And as a result of doing that job for a year, I wanted to actually be back into a trust and help with improvement. So I came to Sherwood Forest in May 2018 as the head of nursing for urgent emergency care. And as you probably gathered, I've never done that sort of thing before from the traditional background. But actually it was great because what it really underpinned to me was what was said to me many years prior. Once you've got the qualification, you can do anything. So actually it's about working with people, drawing on the leadership stuff that I've done already before, and the fundamentals of nursing are the same no matter where you do it. So I may not have worked in the specialities that I've worked in now, but actually the fundamentals of working with a team, leading a team are the same no matter where you do it, and the implementation of improvement stuff is the same no matter where you do it. So, and then this is my fourth day in my current job as corporate head of nursing. So I'm kind of I've had quite an interesting journey, and my next academic piece of work is I'm on the Aspiring Deputy Chief Nurse programme. So my aim is to complete that to then apply for a Deputy Chief Nurse job in the future. And I've also done qualifications in ergonomics and human factors, so actually why we work the way we do. So I've kind of done a combination of academic work whilst working within a hospital, and actually it's quite a interesting, diverse role, because one minute I can be helping an ED, the next minute I could be writing a paper that goes to the trust board, or I could do something like this. So the diversity the role offers is really interesting.
So all of these qualifications that you've got, did you get some of these through the hospital? Do they encourage you and send you on these courses essentially?
So a combination really. So the one that I'm doing now was supported by the trust, but when I did my master's, I paid for it myself. Okay. One, because I wanted to do it, but secondly, it enabled me the flexibility to move on and move to other trusts if I wanted to. But from a employee perspective, I was encouraged and supported to do it. So they were quite keen for me to go and acquire the qualifications, and I was in a fortunate enough situation to be able to fund some of it myself. But actually I was able to draw upon some bursaries. So when I did my cancer degree back in 2004-ish, I was able to draw upon some central funding. So I was able to draw on that. When I did my postgrad certificate, I paid for some of it myself, but I was able to draw on some funding. So actually it's around, I had the conversations with people and said, I'm interested in doing this. And they went, okay, what can we do to help you to do it? So it may be that I had to put a little bit of the cash up, or they helped me with an application to apply for a scholarship. Yeah. So it was quite a varied combination, really.
That's really good. So what would you recommend the students do if they wanted to pursue a career in your field? Where would they start?
So it's worth making the mind up. Do you want to do it? Do you not want to do it? And if you're undecided, that's fine, because there are still days now where I go, do I fancy doing something different? Yeah. For many of you, you will have a 50-year life ahead, working life ahead of you. So you may have more than one career. So it's okay to start something and start your nurse training and go, actually, this is what I want to do. It's worth looking into what is the role of the nurse, because actually there's still some different viewpoints. So actually everybody thinks nurses are women still. So I still find it very odd. I've been doing it now nearly 20 years, and people are still surprised that I am a male nurse. And despite the fact that male nursing's been around since the 1960s, when they were registered, but prior to that, male nursing was around in the First and Second World War. That
It's madness, really.
be a nurse in the same way that you can be a female and be a doctor.
Yeah.
So it's, if you want to do it. Don't listen to what anybody else says, because everybody has a view and an opinion.
Yeah.
It isn't about what people perceive it to be as being a doctor's handmaiden anymore. We are educated to degree, masters, or even higher level. So we have nurses who've got PhDs in research, so they have a doctor's title, but they are still a nurse. So we're no longer doctor's handmaidens. That view is historic, and actually we are our own individual practitioners. We work within evidence-based, we work with autonomy, and we work with patient groups. It is an interesting role. Some days it is a hard job to do when you're working with families, breaking bad news, but actually some days it's a really good day. So when I worked in oncology and somebody's got the all clear from their cancer, that was a really nice day. But actually for that next family member where it wasn't a nice day because their loved one had come towards the end of their life, but it was actually making it as best as you can experience for them. So their loved one wasn't in any pain, they were comfortable, and the family member felt it was okay to ask questions. So for many of you and many of us feel that that is a bad day, but actually for that family member, when they go home when their loved ones died and they know that they were pain-free, they were comfortable, and they could ask questions, actually that's also a good day, because there's somebody who's gone home feeling not happy, but actually they weren't worried or wished I could have done something different. So it's about the difference you make to somebody's life that you, in all honesty, you don't get in any other career pathway. And it's worth looking at doing voluntary work. So we do have schemes to do voluntary work within hospitals. It's also worth looking at different aspects of it. So you can still train to be a learning disabilities nurse, a children's nurse, a adults nurse, and a mental health nurse. And actually you can go anywhere. So a lot of nurses that I trained with are now working in Australia and New Zealand. So it kind of gives you that passport to go and encounter new experiences. But if you want to do it, it's worth looking into, researching, and being open-minded, because actually some of the stuff that you do here isn't accurate, and it's not all like casualty in Holby. So not everybody looks like they do, and it is very different, because they have staff awards, unlike Holby, and it is very, very different. And it is worth just actually being realistic, being open-minded, that you will be with somebody when they give birth to their child, but you'll also be with somebody when their loved one dies.
Yeah.
And unlike the media and the way programs portray it, when we do CPR on somebody, they don't wake up and go home and go, thanks very much. They do have a longer length of stay in hospital. So it's around, the quick point is, don't believe everything you hear and don't believe everything you watch. And it's the same thing with every profession, really. It's like firefighting. They don't put fires out every day, do they? So it's about just being open-minded and ask people, because so if we think about within any hospital, the biggest workforce is nursing. So actually most of you will know a nurse, or your family member will know a nurse. So it's worth asking them, but also as well, take that with a pinch of salt as well, because some nurses have had a fantastic career and some go, I hate it, this, that and the other, I'm looking for something else. And like I said a few moments ago, there are days when I go home and go, is it time to do another job? We all have that. So it's around being open-minded when you are talking to people about career choices. What is it you want to hear versus what they want to tell you?
Yeah, exactly. Is there anything you'd have done differently throughout the course of your career? I know you say you stumbled into it. So, and when you say you consider maybe doing something else, is there anything in particular that you have in mind?
No.
No.
Which is quite bizarre, really. So I wouldn't know what else I would do now. And that's not because I've done it for so long, I wouldn't know what else to do, because I'm quite fortunate that I've got a wealth of experience that I've accrued within my current job. So I could go and work for companies that go in and help industries turn themselves around. So even though I'm a nurse, I can still go in and look at how can you make your service more productive? How can I look at your processes of working? Because actually the fundamentals are very similar. Actually, I don't know what else I would do. And there are some times where I go, I wish I'd spent a little bit of time doing something else. But actually, I'm really glad that I have done what I have done. So what I hope what I have done is enable people to do what they wanted to do. So my aim was I wanted to lead and develop others, that actually looking back at the people I've worked with, mentored and coached, who've gone on to do some really good stuff. So I'd seen that I've enabled them to do that. So I don't think I would do anything different, but I suspect in whatever career people do, they do have that as well. Yes. So my brother works in Nigeria as a operations director, and he has the same. He goes, I'm unsure why I'm still doing this. And then I go, well, what would you do? And he went, nothing, because actually I really enjoy what I'm doing. So it is the same. And in the same way that when you're in sixth form, doing your A-levels, you have the day of going, actually, I don't know why I'm bothering anymore. But actually the next day you go, actually, I'm really enjoying what I'm doing.
Yeah.
That's staying across throughout your life.
Yeah. Have you got any kind of, pardon, sorry?
Okay, not to know what you want to do.
Yeah. Are there any kind of resources that you've got that you could recommend for the students, whether that be books, websites, podcasts?
So the NHS employers do quite a lot around looking at different professionals available within healthcare. So I've spoken predominantly about nursing, but we have physiotherapists, we have occupational therapists, we have dietitians, obviously we have doctors, we have porters, we have cleaners, we have catering assistants, we have chefs. So you name it, we have it. So it's worth looking at NHS employers. So like maintenance, so we have plumbers, we have joiners, we have painters and decorators. So whatever you can, we have accountants as well, human resources. So whatever you can think of. Obviously we don't have astrophysicists because we don't look it up, but we have enough everything else. So we have pharmacists, people who work in the labs. So there is literally a plethora of jobs within the NHS that you can do. So it's worth looking at NHS employers.
Okay.
It's also worth having a look at some of the university websites. So and look at the health sciences schools, and they'll signpost you to different stuff, but they'll also give you the experience of what it's like being a student. And then it's also worth looking at the Royal College of Nursing, Royal College of Midwifery, and each of the respective professions have their own Royal College. So Royal College of Medicine. So it's worth just Googling what is nursing, or what is the role of a doctor, because at the power of your fingers there is loads of resources out there, but it is worth looking at NHS employers first, because that'll give you a really good grounding of what the professions are and what you need.
Yeah.
But also as well, I have colleagues who have done the physiotherapy training, who've done the nurse training, who've gone on to become doctors, because you can do a shortened course to then go on and become a doctor. I also know people who've been nurses who've gone on to be physiotherapists. I've also known physiotherapists to come and be nurses. So you do have to do training to move between professional fields. But actually what it does mean is once you've done it, you can do other things.
Yeah, that's really, really useful to know. Those websites that you just suggested, I'll put them along with this video so the students can have a look at them as well. I don't actually have anything else to ask. You've given a lot of information and it's been amazing. So thank you so much for coming to speak to me. I really do appreciate it.
And if you want me to come back, I'm more than happy to.
Yeah, I would have you back, and I'd also probably have you for like a live session with the students if you're happy to do that. I'm sure they'd have lots of questions to ask you.
Yeah, that's fine.
Amazing. So thank you so much, and I will speak soon.
Okay, thank you.
Thank you. Bye.